Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. So glad that you could join us once again. We'll be speaking with Dr. Lyn Guenther in this segment, Professor of Dermatology at Western University in London, Ontario, Canada, joining us to discuss the FDA approval for a label update for Otezla. Welcome to Health Professional Radio, Dr. Lyn Guenther. Thank you so much for joining us this morning.
My pleasure.
Now, I mentioned that you are, of course, Professor of Dermatology at Western University. Give us a brief look into your professional background, and then let's talk about this Phase 3 DISCREET trial concerning Otezla.
Perfect. So, as you mentioned, I'm a Professor of Dermatology at Western University. I did my dermatology residency at the University of Michigan in Ann Arbor, Michigan, and I'm also President of Guenther Research Inc. and have participated in several psoriasis trials, including trials in genital psoriasis.
For listeners who possibly may not be familiar, what is psoriasis? Give us some of the details of this condition, if you would.
So psoriasis is an autoimmune condition which can manifest anywhere on the skin as red, scaly, very itchy typically, often irritated plaques, and they often bleed because the blood vessels are very close to the surface. So it has a major impact on patients. You can imagine if you are itching, you can't scratch everywhere, and it's a big problem for many of our patients.
Now, you say it can manifest anywhere on the body, right?
That's correct. Yeah. There are common locations, so you can get it on the scalp, the elbows, the knees, the lower back, sacrum, but it can really occur anywhere, including the genital area, and that's why we are looking at, that's why we conducted this study, because it's a high-needs area.
You were an investigator for this DISCREET study, this Phase 3 trial that assessed the efficacy and safety of Otezla in patients with moderate to severe plaque psoriasis and with moderate to severe genital psoriasis, as you said. Tell us about this study and some of the results.
Well, this was the first study looking at an oral systemic for genital psoriasis. We had done a biologic, which is an injectable, ixekizumab trial for genital psoriasis, and it showed very positive results and a label change. But a lot of patients don't want to have an injectable. They would prefer a pill to treat their psoriasis. So this was great because we now have an oral systemic that has the indication for genital psoriasis. But you first of all have to show that it works. So Otezla had been around for some time. It was first marketed in 2014 for adult patients who are candidates for phototherapy or systemic therapy. And its mechanism of action is the phosphodiesterase 4 inhibitor. So the neat thing was that we now have a new medication to treat, not new because it's been around for a while, but an old but now indicated medication that we can use to treat genital psoriasis. Genital psoriasis has been topically treated in many cases, but in fact, many patients don't even talk to their physicians about it, and so they don't get treatment. 2/3 of them don't get treatment. So it's has a major impact on their quality of life, and it's far more common than people think. In fact, up to 2/3 of individuals with psoriasis will have genital psoriasis at least some point in their time. And it can have itching, pain, burning, stinging, redness, cracking, and impacts their sexual functioning. So it has a major impact on their lives. So it is nice to have something that we can now use. Topicals had been used, but they're often messy, burn, and irritate. And this trial looked at people who had tried topicals and that they had not been effective. So it was the next step for patients. It also included patients who had less than 10% body surface area involvement. Typically, when we're looking at systemic medication, we look at 10% or more. And up to 60% of individuals in this trial could have less than 10%, which even though the genital area is about 1% of the body, it has a major impact on people's quality of life. So it was nice to show that it was effective and safe in this population as well as the more severe population, because the genital area can cause quite a major impact on patients.
Does this condition manifest deep below the surface of the skin? Is this something that stays just on the surface? Can it affect deeper into the tissue?
So It manifests primarily in the epidermis, which is the upper part of the skin, but the dermis also has a lot of immune cells which are involved with causing psoriasis. So there are mediators of inflammation. It is an autoimmune condition where you have overproduction of inflammatory mediators of inflammation, cytokines. And so they are involved in the dermis, but even in the genital area, I've had some patients where we do an ultrasound and the skin has been 1 inch thick. It's hard to believe, but the skin has been so thick in that area, so you can imagine the impact on patients. So there really is a need for more effective treatment.
How far did this study concern itself with any of the stigma of psoriasis? And is this something that affects younger people as well as older people? Are men or women more affected than others?
Men and women can be equally affected. It has an impact perhaps more on women than men, but I think it's often because men don't discuss it as frequently as women do. So I suspect that men may be equally affected. It's just they don't discuss things as commonly as women. So it does really affect them. And sometimes, I've had people that don't want to have intercourse with their spouse because they're so embarrassed or their spouse doesn't want to touch them. So it really has a major impact on patients. In this trial, it was a placebo-controlled double-blind study of Apremilast, which is the oral medication, 30 milligrams twice daily for treatment of moderate to severe genital psoriasis. So there were 289 patients who were randomized roughly equally to both arms, placebo and Apremilast. And as I mentioned before, up to 60% of the patients had less than 10% body surface area involvement. Now, similar to the phase 3 registration trials for Otezla, more than 3 times as many patients achieved an overall, that means all of their skin, not just genital, physician global assessment score of clear or almost clear with at least a 2-point improvement at week 16. So it replicated those trials, which is always good because you want to make sure that the study results are potentially reproducible. So if you see things that you have seen in previous trials, it suggests that that trial is actually valid. Now, looking specifically at the main reason for why we're doing the trial with the genital area, we had at least twice as many people, but being clear or almost clear with at least a 2-point improvement in the genital area. And twice as many people achieved at least a 4-point improvement in genital itch. Now, itching is a major issue for these patients, so it is great to be able to relieve some of their itching.
Is there anything that you'd like to add? And then give us a website, if one exists, where our listeners can learn more.
Well, one of the things is I think people need to ask about genital psoriasis. Patients are embarrassed. They don't bring it up. And if you can treat it, you have a huge impact on patients' quality of life, and they're forever grateful that you can actually relieve their genital psoriasis and quite frequently clear it up. So don't forget it. Do speak to patients. Often what I say now is patients, if you ask them if they have it, they often say no. But if you say, do you have it because I now have a treatment that I can give you to clear it, they will come and talk about it because they want it gone.
Okay.
So speak about it, offer treatments. Patients don't need to suffer. We now have a approved medication that has been shown in double-blind placebo-controlled trials to be effective for this condition. So do not undertreat your patients, treat them, and improve their quality of life. In order to learn more about this medication, you can go to otezlapro.com.
Well, Doctor, I appreciate your time this morning. Thank you so much for joining us here on Health Professional Radio, and I'm hoping that you'll return and give us some updates.
Be my pleasure. Thank you.
Thank you. You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Lyn Guenther. Audio copies of this program are available at healthprofessionalradio.com.au, also at Anchor, Spotify, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.